Hi, my name is Roaa, and I'm a graduate student at the Institute for Health Policy, Management, and Evaluation at University of Toronto, and a graduate student trainee in the Unger Lab at the Hospital for Sick Children. Thank you so much for taking the time to view my poster as I provide an overview of my project, which is a cost-effectiveness analysis of Megateam, a video game-based cognitive rehabilitation for children with ADHD. Children with neurodevelopmental conditions like ADHD might have some difficulty in their executive functioning abilities that include emotional and behavioral regulation. And Megateam is a computerized cognitive training that targets these functions, and its clinical impact is currently being investigated by Dr. Crosby's team at SickKids. While such interventions might have an impact on clinical, neuropsychological, and academic outcomes, the cost-effectiveness of this treatment option is unknown, and such evidence is important because understanding the impact of Megateam on resource utilization and health outcomes can inform treatment choices and options for children with ADHD, their families and caregivers, as well as policy funding and reimbursement decisions at large. Therefore, the objective of the study is to evaluate the health and economic impact and the incremental cost-effectiveness associated with Megateam when compared to treatment as usual, and the economic evaluation adopts three perspectives: that of the family, the public payer, and society. When we look at the methods in conducting this economic evaluation, we see children with ADHD aged 6 to 12 years who live in Ontario were randomized to receive Megateam or the comparator treatment as usual. This economic evaluation compares the 6-month costs and health outcomes of the two treatment groups. The primary measure of cost or service use is the Resource Use Questionnaire for Developmental Conditions, which is administered to parents and caregivers at baseline and 6 months. Respondents can then report the frequency, duration, and out-of-pocket costs associated with the use of healthcare services like doctor's visits or occupational therapy, as well as non-healthcare services like specialty camps, other recreational activities, and school support programs like tutoring. The primary measure of effectiveness, or the primary measure of health outcomes, was quality adjusted life years, or QALYs. And QALYs are estimated through health state utility values that are derived from the Health Utilities Index, which is an instrument that is administered at baseline, 5 weeks, and 6 months. Analyzing this data, the primary outcome is the incremental cost effectiveness ratio, or the ICER, calculated as the additional cost per every QALY gained when using Megateam compared to treatment as usual. This ICER is calculated by comparing the average group costs for each group and the average QALYs for each group. To calculate the ICER, other secondary outcomes include calculating the total costs and QALYs per person for each group at baseline, and the total costs and QALYs per person in each group at 6 months. These costs include costs incurred to the family unit, to the public payer, like the publicly funded healthcare system, or to society at large for services, for instance, that might be partially or fully covered by private insurance. Using these perspectives allows us to estimate the impact of Megateam on resource utilization across different sectors, settings, and payment methods. And it allows us to calculate the difference in the average costs and the difference in the average QALYs per treatment group to then decide through the ICER if Megateam is cost-saving or cost-effective. Examining preliminary results, we see a study sample or a study population that is mostly male, around the age of 9 or 10 years old. When we look at the services or the resources they've Next steps include comparing the resource use at baseline and 6 months for each group. Here are the services at baseline and 6 months for group 1 and group 2. And together, we then can find the average costs per each group, the average qualities or health outcomes for each group, which would allow us to estimate the ICER or the incremental cost effectiveness ratio to then determine if Megateam is cost saving or cost effective when compared to treatment as usual. Thank you so much. Please feel free to let me know if you have any questions, or please feel free to reach out if you have any more questions. And thank you so much.